I know you're not a women's health, specialist, but you've definitely been around in this world. And one of the things that surprised me, at least nobody tells, a 20 or 30 something year old guy, that women, when they go through pregnancy, then they have all these added challenges, like problems where they leak urine and where they have trouble like doing all kinds of things that I never had any idea about. What are the unique challenges after a woman gets done having a baby that people don't know about?
So many, gosh. And I feel like there's now, having gone through it, I understand them so much better. I had just learned about them before and seen patients struggle, and now I know. So I've been working with Legacy and Brooke at Legacy Physical Therapy, and she's done a wonderful job helping me. But when you come back, so a lot of your joints are impacted by pregnancy, from just the way that you stand and the way your back is positioned to the hormones you release in order to be able to birth the child.
This part's crazy, right? This is the part that I like. While you're pregnant, you start having these hormones that allow your pelvis to like become more flexible.
Your ligaments relax. Yep. So they kind of are going to be more stretchy than they usually would be. Yep. And so that way the bones of your pelvis can shift around a little bit to get ready. So that's in the first and third trimester. And so in the first trimester, I definitely got to experience those aches and pains related to that. But again, thank goodness I'm a PT, so we could get rid of them. So fortunately, I was able to get rid of them and keep running until I was so sick I couldn't run anymore, because the doctor said that I shouldn't keep running because I had so much vomiting. But yeah, so that's in the beginning and the end. So first and third trimester, it really impacts you.
And it changes like the way that you stand and the way that like you have your posture.
I would say
right?
the weight that you gain changes the way that you stand and the way that you gain it. And so also as your abdomen continues to expand, the abdominals aren't going to support your standing posture in the way they did once. And so people develop just poor postures that oftentimes they don't get rid of after they have the baby, because then they're holding the baby in front of them. And so they're in postures that just aren't ideal for glute recruitment. It's not great for your back and your abdominals. It's not good for the nerves in your spine. So there's a lot of positions that you adapt to during the pregnancy and while taking care of the child that are not great. Not great for your joint health, I guess.
So imagine you were in a PT. Do women know about this? Like, it never even dawned on me that when you're going to be nursing a child, you now have actual milk in your breasts, and that is actual weight that you're now carrying around, and it shifts and it changes. Like, none of these things occurred to me.
Right.
But do women know about this?
I mean, I guess... So I think it's in the running world and also in CrossFit, it's becoming a lot more athletes are aware of pelvic floor problems after pregnancy. And I think there's been a lot of push. There's a lot of physical therapists that work in the women's health, pelvic health area who are trying to increase awareness so that people know that it's not problems that they might have with incontinence aren't normal, and that there are ways to improve it and even get rid of the symptoms completely. And that
what is incontinence?
So if somebody might be leaking urine when they're running, for example, or when they go to lift a heavy weight, or if they were to go to the trampoline park with their child, or in some people, just when they get up out of the chair and they have to put more effort forward. And so if you address those problems early, then it's much easier to get rid of them than addressing them 30 years later. But you can still make a difference 30 years later. You can still improve somebody's quality of life. And, you have muscles that are controlling that, just like muscles everywhere else in your body. They can be trained. But just like anywhere else in your body, if you don't use a muscle well, or if it's used poorly for a long period of time, you can change the fibers themselves. They can become more stiff or less compliant, or it's just, there's so many. So, this isn't my area, but the pelvic floor muscles can be too tight. They can be not recruited well. They cannot recruit at the same time as your abdominals. You can have a poor abdominal recruitment pattern that creates too much pressure down on your pelvic floor. I mean, there's a lot of things that can cause incontinence, but you should interview somebody that this is their whole area, because they'll be able to speak to it I mean, if I have a problem, I'm going to see.
Yeah, I mean, the reason I bring it up with you is that because, I had read about this happening to women in Africa, right, where they have some problem and the leaking causes them to like smell bad, and it just thought like, oh, that's a problem that people have.
Read about fistula,
right?
Yeah, so that's a bit different of an issue.
But what I'm saying is what I was imagining is these are problems faced by people far away, and I did not realize these are problems that regular women face all of the time. And so like as a man,
people that didn't have severe trauma during the delivery of their child still face these. Even if you had a normal delivery and you had minimal tearing and things went fine, you can still experience some of these problems.
I think that this is one of the parts of the conversation that I don't know if men used to know this or they never had to know it, but it seems to me like I would have been far more understanding of my work colleagues that had a child had somebody sat me down and been like, all right, when a woman has a baby, it's not just that she gets big and she puts on weight and it's a little uncomfortable. These are all of the things that are going to happen to her. And then once she's done having the baby now cries, maybe 8 hours a day on top of trying to fix these problems. And so for me, not knowing those things made it so it was not possible for me to have any concept of what my colleagues around me were experiencing. In fact, I'm embarrassed of, I don't think I was ever rude to anybody, but at least in the way that I thought about it.
I guess I knew a lot of these things, and I still think I could have been more compassionate. So it's not just you.
Well, that's good.
Yeah. Anytime you experience something that's challenging, or maybe a close person to you experiences something that's challenging, you become more sympathetic.
So, thanks for checking out this podcast short. If you like this interview, make sure you hit the like and subscribe button and hit that bell so you always get notified about this podcast. And if you're really interested in conversations like this, you may want to consider joining the Articulate Ventures Network. To find out more, go to network.articulate.ventures.